The country we got for our global healthcare project was Panama. The Spanish-speaking country, Panama, is a transcontinental country that sits between North and South America. Panama has a population of 4.2 million people and a poverty rate of 21.4%. The breakdown of the poverty rate is 11.9% in urban areas and 41% in rural areas, which is staggering. The average schooling time for children in Panama is 9.3 years, with a life expectancy of 73.8 years in 2018 and an infant mortality rate of 12.8 people passing per thousand in 2019. In Panama, most doctors prefer to live in the cities or in urban areas because they do get paid more, and this does contribute to health issues in rural areas as well. Some of the largest concerns in Panama are poor drinking water quality, malaria, and yellow fever.
So there are three types of hospitals in Panama that I'm going to talk about. Some are governmentally funded, some are privately funded, and some are actually funded by entities outside of Panama themselves. So we'll get into that. The first type of hospital are the public hospitals, also known as salud clinics. These public hospitals are completely government run and funded through the NHS, so you can think of the Britain's National Health Service. This means that it is completely free to go there for any Panamanian resident. The problem is healthcare workers shortage is an issue in these public hospitals, as it's hard to keep staffed. These areas where these public hospitals are very rural areas, and they support mostly indigenous people that aren't able to get to private or publicly funded hospitals, larger hospitals, as easily. So keeping staff workers and good doctors in these areas is very difficult. The next type of hospital is the Social Security hospitals. These are funded by the Ministerio de Salud, or their health ministry. It's also funded through Caja de Seguro Social, which is like their social security. This is where most of Panamanian doctors work. Even if you are a private doctor that works specifically at a private hospital, you do have to do some time at these public hospitals. Everyone that works in Panama pays into funding these social security hospitals. So 3.5 of the 4 million citizens within Panama, part of their employment, money from employment, goes into funding these hospitals. And because of that, there is no charge. And because of that, Panamanians go to the hospital quite often because they don't have a charge, or because they know there will be no charge. So these are the most utilized hospitals within Panama. And then there are privately funded hospitals and clinics. These are backed mostly by either private companies or monetary funds. Some are affiliated with U.S. entities. So the picture here of Punta Pacific Hospital is partnered with Johns Hopkins Medical here in the U.S. This is where healthcare workers that work here get paid the highest. You see a lot of specialty doctors here. There are also a lot of international doctors that will come to work in these hospitals because of how well funded they are. They also usually have the most up-to-date equipment and time management of any of the other different hospitals. They serve mostly upper middle class and high class citizens of Panama. So if you can pay to come to these hospitals, you usually do. There is also some market for medical tourism. So people outside of Panama can come in to have elective procedures that might have longer waiting lists back in the countries they're from. So these are people that either can't wait to pay for, but can pay for life-saving procedures like organ transplants or elective procedures. Some cosmetic procedures are also done at these higher funded, higher class hospitals.
So as Dakota mentioned, the healthcare system in Panama is split up into a public and a private system. That being said, the vast majority of citizens use the public system provided to them through the Panamanian government. The first important aspects of Panama's public health system is the MINSA, or MINSA, which stands for Ministry of Health. This government agency oversees many different aspects of healthcare for Panama, but also provides direct services for many citizens. The Ministry of Health receives funding from many low-cost facilities across the rural parts of Panama called salud clinics, as well as government funding stemming from certain types of federal taxes. As I mentioned, the Ministry of Health provides salud clinics for all citizens, but they're primarily located in rural areas where people might not have the ability to get to a big city hospital. The Ministry of Health operates 830 clinics nationwide, and it's accessible to roughly 47% of all the people in Panama. Yet it's mostly used by low-income people. These clinics specialize in outpatient services and are the cheapest option for low-income families. So the Ministry of Health is also the primary entity in charge of overseeing the combined health system and creating policy and regulation for Panama. So this entity is responsible for making most of the healthcare decisions that deal with Panama's health system. The MINSA accounts for roughly 30% of public spending or public healthcare spending across the country. Next, we have the CSS, which stands for the Social Security Fund, or Caja de Seguro Social. The CSS is the primary healthcare system used by the majority of citizens. It's funded through national Social Security taxes, by employer contributions into employee pension funds, and employee contributions from their Social Security funds as well. Everybody, or as Dakota mentioned, everybody who works pays into this. The CSS provides all healthcare services, which ranges from giant hospitals to small PCP clinics. The CSS also has a majority of doctors and patients. So the way this works usually is citizens, like I said, will pay Social Security taxes, and then when they go to these clinics, they end up not having to pay anything out of pocket. And this ends up covering 70% of the public spending, and covers, like we said, about 84% or the majority of people who in the country, because if they work, they're going to be covered by this. Panama also has the policy that lets foreigners use this CSS funding as well. When they come in, if they're especially like expats, which means just people living outside, or people from outside living in Panama, they're able to use certain types of funding from the CSS as well. There are some problems, however, with this healthcare system. Some of these include the really long wait times for public facilities. As we've said many times, like the majority of people use public facilities, especially the CSS facilities, which creates long wait times for normal procedures and normal services. They also have a lot of old and outdated equipment and facilities that go into the public healthcare system. And oftentimes, this is kind of a weird thing in Panama, but overnight stays in hospitals happen to be in public rooms, so there's not really much privacy if you happen to be staying there overnight. There's also not as many specialized physicians or highly specialized physicians, so citizens might have to go to a private healthcare system to pay for a certain procedure or try to find it somewhere else. And then finally, the public healthcare system also lacks certain types of prescription drugs that you may be able to find somewhere else in the private healthcare system or in a different area. Finally, COVID-19 has also impacted Panama just like every other country in the world. As I mentioned earlier, the Ministry of Health is the primary entity in charge of national health policy and decision making. So they're the ones that were in charge of making healthcare decisions for the country in regards to COVID. Some of the decisions that they made were suspending school and universities and gatherings of 50 or more people after a few months into COVID, or once everything started to get shut down in the rest of the countries around the world. The Ministry of Health also called upon the entire nation to donate blood, especially those that have already had COVID and recovered from it successfully. June 2nd, 2020, the Ministry of Health created a mask mandate, which declared that anyone not wearing a mask could be subject to a fine. And then finally, the Ministry of Health announced that they were going to create a gradual reopening plan, which includes reopening commercial air travel and other things as the nation's health starts to improve. So As of March 21st, the Ministry of Health has declared a total of 350,991 cases of COVID-19. There's been approximately 6,000 deaths. The Ministry of Health has created many policies to combat this, but most recently they approved the vaccination of their citizens and are actively creating a vaccine rollout plan, which just means that they're trying to get the vaccine out to their citizens as quick as possible. And however, despite the vaccine being utilized, many school activities and universities and businesses remain suspended at the moment. And then here's a list of references that we used to create this presentation and obtain our data.